Ovarian cyst is fairly common and majority of the women have ovarian cyst at some point of time in their life. I am Dr. Suman from Max Hospital, Gurgaon. We will discuss today about the ovarian cyst if occur in pregnancy, what precautions to be taken. What is ovarian cyst? Ovarian cyst is fluid-filled sac arising from the ovary. Mostly it is diagnosed on the ultrasound. Most of the women doesn't know that they are having ovarian cyst. They don't have any symptoms. Sometimes women have pressure effect, severe abdominal pelvic pain, and have the fainting attack. It is frequently asked by the patient that is ovarian cyst affect fertility? They will become pregnant or not if they are having the ovarian cyst. I must say that most of the cysts are functional, like follicular cyst and corpus luteal cyst. They appear sometime in the menstrual cycle normally and disappear after 1 to 3 months without causing any harm to the woman. Corpus luteal cyst is the pregnancy cyst. It is even beneficial in the woman and it supplies the progesterone to the woman till the 12 weeks of the pregnancy, then it disappears by its own. On the other hand, some cysts like the endometriotic cyst, it affects pregnancy. Women may remain infertile if they are having the endometriosis. Sometimes it happens the infertile woman may have endometriosis in 50% of the cases. At the same time, polycystic ovarian disease, that is a very common disease in our society. The women are having hormonal imbalance. Ultrasound shows that multiple small cysts in the ovary and they have irregular period. This cyst make the woman infertile and there are lots of other problems women face if they are having ovarian cyst. Lots of time women with PCOS require intervention from the gynecologist to become pregnant. If they become pregnant, baby and mother both are at risk. Mother can have diabetes and hypertension in pregnancy and baby may have miscarriage and IUGR. Therefore, PCOS with pregnancy have lots of implications which has to be taken care of. Some other type of cyst like cystadenoma, which is very common in the young woman who is planning for the pregnancy. Generally, they don't cause infertility, but if the woman become pregnant, they enlarge in size. They may cause torsion or twist or they may rupture. It can cause problem during the pregnancy. One is dermoid cyst. Dermoid cyst is the cyst which contains tissue of the hairs, bones, teeth inside the cyst and they tends to twist very fast. And in pregnancy, woman comes with a pain abdomen and we find out this twisting in the dermoid cyst and patient require immediate surgical intervention. Although rare, but sometimes women has ovarian cancer if they are planning for the pregnancy or while they are pregnant. That is the time they should go to the doctor immediately because it requires a team approach to manage them. Therefore, it is important the women should not ignore their symptoms if they are planning for the pregnancy. They should go for the routine ultrasound so that ovarian cyst can be diagnosed before pregnancy. If the women are diagnosed with the ovarian cyst, they should discuss with their doctor about the treatment option for the better pregnancy outcome. If their doctor suggests that ovarian cyst need surgical removal, it can be done by laparoscopically. Laparoscopy is the mini hole surgery where the very small incision is made and ovarian cyst can be extracted from the abdomen. It requires expertise, but there is little blood loss and women can recover very soon. They can plan the pregnancy in the next month. The next question is there, if the woman is diagnosed with the ovarian cyst and they are pregnant, what precautions they should take care? Generally, the women have ovarian cyst that is functional and that will disappear by the end of first trimester. So there is no need to go for any treatment for them. But if the women have some cyst which is organic cyst, they should monitor for symptoms like pain, like pressure effect and they can go for the ultrasound at periodic intervals so that we can see that cyst size is increasing or not. Sometimes it happens that doctor says that the woman should go for the surgical removal of the cyst. That is important to know. The best time for the surgical removal of cyst is in second trimester before 20 weeks. That will cause no harm to the fetus as well as to the mother. Sometimes the women are diagnosed with the ovarian cyst in third trimester, near to the delivery. And if cesarean is planned for them, they can discuss with the doctor if the cyst can be removed at the time of cesarean. And women who is having normal delivery, cyst can be removed 6 weeks postpartum by laparoscopic route. Although it's important to understand that most of the ovarian cysts do not require surgical intervention, they go themselves without causing any harmful effect. Some ovarian cysts like PCOS and endometriosis may require the medical treatment. Uncommonly, ovarian cysts require the surgical treatment, and that is possible by the laparoscopy. Laparoscopy is minimal invasive surgery. It requires expertise, but it is very much patient friendly. It is available in most of the hospitals nowadays. There are many myths around the ovarian cyst, but we should not believe on those myths. If the woman is diagnosed with ovarian cyst or they are having symptoms suggestive of ovarian cyst like the pressure effect, like severe abdominal pain, they should visit the doctor. They should discuss the doctor for the better treatment plan.